Okay, let's just dive right into this explainer, shall we? Today, we're exploring the seriously fascinating and honestly kind of hidden world of healthcare waste management, specifically looking at it through the lens of the SASB standards. When we think about healthcare, we usually picture saving lives, crazy cutting edge tech, right? Patient care. But there is this massive, almost invisible operational side to the industry that's completely governed by strict financial and environmental accounting. So today, we are looking at the exact sustainability accounting standard, version 2023-12 to be precise, that's used to strictly measure and manage the literal mountains of waste generated by hospitals and clinics. To kick things off, we really have to ask ourselves a pretty practical question. Where does an unused syringe, a contaminated biological culture, or, say, an expired hazardous medication actually end up? I mean, it doesn't just magically disappear, right? Every single one of these items has to be tracked, measured, and accounted for. This isn't just about making sure you throw things in the right colored bin. It's about rigorous, down-to-the-gram corporate sustainability reporting. So here's our agenda for today. We'll cover the Healthcare Waste Challenge, tracking regulated medical waste, sorting hazardous versus non-hazardous pharma, calculating final waste disposition, and finally, why all this quantitative tracking actually matters. All right, let's jump straight into Section 1, the Healthcare Waste Challenge. The stakes here? They're incredibly high. The SASB standard explicitly points out that healthcare providers generate a massive, massive amount of regulated medical and pharmaceutical waste. But here's the real kicker. Disposing of a biohazard bag costs significantly more than just tossing out your everyday garbage. If a hospital isn't tracking this stuff properly, they aren't just risking environmental non-compliance, they're basically throwing money straight into the incinerator because of inefficient waste segregation. It is a huge deal. Moving right along, Section 2, tracking regulated medical waste. Now, before a hospital or clinic can even begin to track its footprint, it needs some really strict definitions. According to the standard, medical waste, which, by the way, you might also hear called infectious, biomedical, or biohazardous waste, is completely defined by the applicable jurisdictional laws where that facility actually operates. So you simply cannot track what isn't legally defined in your specific area, right? It sets the baseline. And you don't just guess what counts here. The SASB standard specifically lists out the categories for us. We're talking about cultures and stocks of infectious agents, pathological wastes, like human tissues removed during surgery, for example, and human blood products, which even includes things like IV bags. Oh, and it also covers sharps. Now, interestingly, the standard is super specific that this includes both used sharps, like needles used in patient care, and unused discarded sharps. It even extends out to animal waste from research labs and isolation wastes from patients with highly communicable diseases. Every single piece of this has to be aggregated across all the facilities an entity owns. It's a huge umbrella. Okay, Section 3, hazardous versus non-hazardous pharma. Looking at these side by side really shows us exactly how providers have to segregate their pharmaceutical waste. It's a strict split. Hazardous waste displays dangerous traits. Specifically, we're looking at ignitability, corrosivity, reactivity, or toxicity. And get this, if local laws happen to lack a definition for this, the standard actually allows facilities to use the UN Basel Convention to define it, which is pretty neat. On the flip side, non-hazardous pharmaceutical waste is treated more like standard solid refuse or garbage. But, and this is important, it still requires really tight security because, it might be a controlled substance or pose some other human health threat. Both of these streams demand strict, totally independent tracking. Next up, Section 4, calculating final waste disposition. This is where the math really comes in. Just like financial bookkeeping requires exact dollars and cents, this sustainability standard mandates tracking the total amount of waste generated strictly in metric tons. It's all about that quantitative data. So whether we are talking about the medical waste we just discussed, the hazardous pharmaceutical waste, or the non-hazardous pharmaceutical waste, the base unit of measurement is exactly the same across the board. The organization has to aggregate that total weight in metric tons for every single facility it owns and operates. No exceptions. But hey, knowing a total weight, that's really only half the battle. Every single metric ton has to be accounted for by breaking down its final resting place, what the standard officially calls its final disposition. For both medical and pharmaceutical waste, the entity must report the specific percentages across 3 mandatory destinations. Those are percentage incinerated, percentage recycled or treated, and percentage landfilled. And just as a quick aside, if a facility returns waste to a supplier or maybe uses commercial composting, that actually falls under the recycled or treated bucket. So how do we actually arrive at those percentages? Well, the standard dictates a simple but really powerful equation.
Step 1, you take the total weight of the waste generated, let's say your total metric tons of hazardous pharmaceutical waste. Step 2, you take the weight of that specific waste sent to one destination, like an incinerator. Then, step 3, you just divide the incinerated weight by the total generated weight. Boom, that gives you your mandatory reporting percentage. You just repeat this exact same calculation for what's recycled or treated and what is landfilled across all of your waste categories. Pretty straightforward, right? Now you might be thinking, wait a minute, hospitals don't usually run their own landfills or recycling plants. And you'd be absolutely right. But the SASB standard anticipates this entirely. If a healthcare entity uses a waste transport service, a broker, or some other intermediary to handle its medical or pharmaceutical waste, they cannot just pass the buck. No way. The standard explicitly states the entity must make a good faith effort to determine that final disposition method. Basically, they are fundamentally responsible for knowing the complete end-of-life journey of their materials.
And finally, Section 5, why quantitative tracking matters. Looking at these metric codes, we can really see how these categories mirror each other perfectly. Metric HC Di 150A.1 for medical waste and HC Di 150A.2 for pharmaceutical waste demand identical quantitative tracking, total metric tons, and that exact percentage breakdown of incineration, recycling, and landfilling. This enforced uniformity is absolutely crucial because it guarantees total transparency across all these specialized waste streams. Basically, it prevents companies from hiding poor hazardous waste management behind, say, really good conventional waste practices. Looking directly at the source standards master table under waste management, this strict quantitative nature of these rules just jumps right out at you. By forcing hospitals to track these exact metric tons and percentages, the standard is really pushing them to improve. Think about it. Entities that enhance their waste segregation strategies, the recycling and reuse, they can actively limit their exposure to those incredibly high specialized disposal costs we talked about earlier. Better tracking directly equals better cost control, for sure. So as global healthcare continues to grow and populations age, we really have to ask, how will this precise accounting transform the industry's environmental footprint in the long run? When every single metric ton of a toxic chemical or a biohazardous sharp is meticulously weighed, tracked, and reported, it forces a level of operational discipline that permanently changes how hospitals consume and dispose of materials. It takes this massive, messy environmental challenge and turns it into a solvable, measurable equation. And honestly, that might just be the most effective prescription for a sustainable future.